Doctor, you mentioned using the best of both worlds, and that's combining Eastern and Western medicine. What are some of the most important things that Eastern medicine has taught us?
So you've been on my website.
I have.
You've been on my website.
Mm-hmm.
You know, I've always believed that, I'm a traditionally trained MD.
Mm-hmm.
I'm an internist, and been in clinical practice for over 25 years now. There's no question that there is a role for both modalities. When, give you an example. I have a patient, and I've had numerous patients in the hospital that come in with a fever of 102, 103. They've got a pneumonia.
Mm-hmm.
I am not going to send them home on echinacea, golden seal, and a probiotic. I'm going to put them in the hospital. I'm going to give them intravenous antibiotics. But while they're in the hospital, I will give them intravenous antibiotics, but I will also make sure that I give them a probiotic. I'll make sure I give them a multivitamin, and I'll make sure I give them some B vitamins, because their oxidative stress, their oxidative damage is so incredibly devastating. Their body is going through so much damage. We need the we need the B complex, we need other nutrients. Of course, we need the probiotic because they're on antibiotics, or the good bacteria. And my residents, I'm on the teaching faculty at 2 hospitals in New Jersey. My residents know that when they put somebody on an antibiotic, they better have them on the good bacteria or probiotic also. Let me flip that around. Somebody comes in to me, they have a 99 temperature, 99.2, below 100. And, they got a little cough, they got a little cold, they got a little sniffle. They're not really bringing up any green, yellow mucus. It's not that gross. Yes, I will give you some echinacea, golden seal, elderberry, whatever that I feel, endographis, to help that. I will check you in a couple of days. I tell you if your fever goes up, if there's a problem and you start to get worse, call me and we'll change it over to something else. We'll give you an antibiotic at that point. But having those 2 modalities is what people want today. Mm-hmm. Another great example is people in pain. People in pain. Besides joint pain, besides digestive problems, I think joint pain and digestive problems are the 2 biggest things that we see today. People in pain. Well, I have an acupuncturist in my office. I have a massage therapist in my office. We do Reiki in my office. We do meditation. We do yoga. We do all of those things as part of my practice. The combination of using omega-3s, of using other natural anti-inflammatories, whatever that may be, and combining that with acupuncture, unbelievable. Unbelievable results I've had over the past many years of my practice. So I've been a huge, huge fan of giving people the best of both worlds, Eastern, Western medicine, put them together.
Is that becoming more common, do you think?
Oh, absolutely. Absolutely, it's becoming more common. Again, another example, Raritan Bay Medical Center in Perth Amboy, New Jersey. I'm on the senior attending staff at that hospital. We have a department of integrative medicine, and I'm the co-chair of that department. Well, in the hospital, before you go to surgery, you can have guided imagery. You can have guided imagery, and there are nurses that have been trained in guided imagery, so that before you go to surgery, they will take you through a whole visualization process of the surgery, the recovery, the healing. And you know what? The data and the outcome data on modalities like this are out there, and we're doing it in the hospital. So is it becoming more popular? You bet your bippy it's becoming more popular today.